All right, this is great. Seeing some folks fill in. Welcome, welcome. And y'all, this is my first time live streaming, if you can't tell. So bear with me, y'all. And let's see. All right. Hello, everyone. Welcome. All right. Welcome to meet our Chief Medical Officer, Dr. Justin Coffey at Workit Health. Workit Health offers clinically proven virtual care for substance use, mental health, and co-occurring disorders. So glad to see everyone tonight. Please say hi in the chat if you're able to. Again, my name is Max Backer, and I am your community manager. I have been in recovery myself for about 5 years. And y'all, we're going to get right to it tonight because we have a lot of questions for Dr. Coffey. Thank you to everyone who submitted a question. And just want to say, if we don't answer your question live tonight, we will do our best to have someone from the Workit staff get in touch with you. As always, if you need any information, you can shoot us an email at support@workithealth.com. You can also get a hold of me if you have ideas for the community, you like to share your story. Go ahead and shoot me an email at community@workithealth, and I'd love to get working with you. All right, so let me give you a little background on Dr. Justin Coffey. We've got some fancy credentials here. Dr. Justin Coffey earned his BA in history, philosophy, and social studies of science and medicine, and his MD from the University of Chicago. He completed psychiatry residency training at the University of Michigan, where he served as chief resident. Coffey holds board certifications in psychiatry, behavioral neurology, and neuropsychiatry, and clinical informatics. He is a member of the American College of Psychiatrists, a fellow of the American Neuropsychiatric Association, a distinguished fellow of the American Psychiatric Association, an immediate past president of the International Society for ECT and Neurostimulation. He serves on the editorial board of multiple scientific journals and has published in the fields of neuropsychiatry, brain stimulation, suicide, care redesign, and health technology. Please welcome Dr. Justin Coffey, our Chief Medical Officer at Workit Health.
Thank you so much, Max. I'm delighted to be here with you and with the community this evening.
Now, that was a lot of words, psychiatry, you know, it's almost even hard to say. How about a little bit about you in your own words?
My pleasure. Well, the first word I'll say is y'all, because I heard that come out of your mouth a few times just now, Max.
Yes.
My roots are in the Carolinas. That's where my deepest roots are. And so I still use y'all, and occasionally I even use all of y'all, even though I don't have my Southern drawl anymore. But I am, by rearing a family man, I'm a girl dad. I have 2 young daughters, and we live now in Pennsylvania. I grew up a soccer player and also a music lover. And once I grew up to adulthood, I became a food lover. That's what a lot of our time outside of our professional days is spent doing, with family, outside, with music, and good food.
Music and good food happen to be my 2 most favorite things. So already, Dr. Coffey, we're vibing. So some of us have that moment in their lives where they just know what career path they are going to go on. What drew you to medicine and behavioral health? Was that always with you?
It was not always with me. Not until a course I took in college on clinical medical ethics. And during that course, the professor, who became a mentor of mine, used a teaching style of role-playing an awful lot. And in that role-playing experience, I first began to imagine myself as a physician, in the shoes of a physician. And what happened to me was I began to want to become a better person. And no other experience in my life generated that kind of desire in me. And that's when I knew my calling was to the medical profession. I started medical school pretty certain I was not going to have anything to do with psychiatry or neurology. I had fallen in love with the ICU, in fact, and intentionally left my psychiatry and neurology rotations until the very end of medical school. At which point, of course, I got to those rotations and I discovered the brain and I discovered human behavior, and the rest is history. I have really been fortunate to enjoy learning and growing in the field of behavioral health and neuroscience during a time when, the advances in neuroscience research have just been exploding, and when the field of behavioral health care is finally undergoing some transformation. So that's the short version of how you and I got to talking here this evening.
Oh, excellent. Neuropsychiatry. I even had a hard time saying it. It's kind of a scary word. How is neuropsychiatry different from the psychiatry we may be more familiar with?
Well, I wish it weren't a scary term. It's like many of the terms that I think we use in the medical profession. They sound fancy to make us sound smarter than maybe we really are. But neuropsychiatry really is simply put, the study of brain behavior relations. So the idea is, if we can understand how the brain works, not only at a structural level, the anatomy of the brain, but also at a functional level, how the circuits of the brain interact with one another and how they communicate to the body, then we can begin to understand in a richer way, human behavior. And neuropsychiatry, of course, is a medical specialty. So the field focuses on illnesses where brain dysfunction leads to behavioral changes. There are a lot of examples of these. Almost any common psychiatric illness has behavioral manifestations. And a lot of normal human emotional experiences come with behavioral changes. So, for example, why is it when you're happy, Max, you tend to raise your hands? That's a universal, across cultural, across ages and eras behavior. It's because our brains and our bodies talk to one another. And neuropsychiatry essentially is listening very carefully to that conversation.
I love how almost easy and non-complicated that sounds, right? To line those two up, in theory, it's easy. So what does neuropsychiatry have to do with addiction? Because I imagine they're tightly linked.
You're absolutely right, Max. One of the kinds of illnesses in psychiatry that we know the most about in terms of brain dysfunction is addictive illness. In contrast, there are other forms of psychiatric illness where we don't really understand yet exactly what's going wrong in the brain. But with addiction, we know a lot about the neuroanatomy of addiction, and the dysfunction in the brain's circuitry when addictive behavior turns into addictive illness. And the wonderful thing about that is, based on that understanding, we have some very safe and effective treatments for certain kinds of addictive illness. So think of neuropsychiatry perhaps not as a subspecialty of medicine, but as a clinical approach to behavioral dysfunction.
All right. Yeah. And I know you and I had talked earlier about my experience with very much dabbling into some neuropsychiatry and learning about the brain, especially when I was getting sober, and how empowering that was to actually learn about the brain in accordance with addiction to figure out what was going on as a way to push away shame, as a way to not take things so personally, that there was this straightforward thing going on in my brain, and therefore there was a straightforward solution. And so I know that just hearing this, learning about this can be so empowering for our members and any folks going through addiction. So I appreciate that so much.
That's such a,
oh yeah,
Max, it's such a good point. It's such a rich point that you're making there. Many of the health problems that our friends and families and neighbors experience and suffer from don't come with that same degree of shame and stigma. Some of them still do, but psychiatric illness and addictive illness still are characterized by an awful lot of shame, and that's not right. And one of the things that I'm hopeful the field of neuropsychiatry can help us and our friends and neighbors and society do is bring the science to light. And just as you very articulately put it, help people understand that this is an illness, just like diabetes is an illness, just like congestive heart failure is an illness. We don't blame people for their congestive heart failure. We don't treat them in a way that makes them feel shamed. Addictive illness really ought to be no different. And as privileged as I am to be here with you tonight, Max, it's not people like me who are going to make progress in that direction. It's going to be folks like you who are speaking from their lived experience.
Thank you for that, Dr. Coffey. I appreciate that. And maybe this is where I should have started, but what does a chief medical officer do for an organization like Workit Health?
On paper, a chief medical officer is a clinician, first of all. I'm a physician by training, and that person holds a senior leadership position in the organization that involves the oversight of the clinical practice. At Workit, the chief medical officer, as I view it, is the lead clinical servant to the member community. My job is to lead a very powerful, intelligent, and passionate group of healthcare professionals who do amazing work every day to take great care of our members and to work with them in a partnership to relieve their suffering. So day to day, what does that look like? It typically looks like mobilizing resources, removing barriers, aligning teams, coaching and supporting people, all in the service of our clinical mission to reimagine addiction care.
And you haven't been with us for too long. When did you start here at Workit Health? June,
1st.
July, I believe. Okay, May 1st. There it is. And we are very lucky to have you. And
Thank you, Max.
I'm curious what drew you to Workit Health in particular.
I am incredibly fortunate to be in the role that somehow I've landed in. And I don't know if I deserve any credit for that other than being willing to open the door of opportunity when it came knocking. I was in my previous role as chair of the Department of Psychiatry at Geisinger, a large multi-hospital health system in Pennsylvania, and one where outpatient and inpatient addiction medicine was a core part of what we did every day. Having fun, doing important work, but got a phone call one day, as many of these stories start, and got to know two very incredible women, Lisa and Robin. And what those two folks have done, not only as individuals, but as leaders, made me want to be a part of what they're doing. And I'm very, very lucky that what they happen to be doing is something that overlaps with my professional training interests and, dare I say, skill set. As we got to know one another and I learned about the philosophy of member-centered design of the care that we deliver at Workit, that's singing from the same sheet of music to me. And some number of conversations later, somehow I was starting a new job, and that was as Chief Medical Officer of Workit Health. I pinch myself most mornings when I wake up that this isn't, something that someone's pulling a fast one on me. And the first few months of being a part of this team have flown by. And so to me, that's just one of among many pieces of evidence that there's a real goodness of fit between the mission of this organization and my own personal mission and professional values. It's an incredible team. Its approach to partnering with members is something that I think separates it, and it's going to help us make a real difference in our society.
All right, Dr. Coffey, you mentioned, if y'all don't know, our co-CEOs, Lisa and Robin, certainly huge points of inspiration for myself as well. And it is so wonderful to hear you talk so cheerfully about what you do. I guess that's not something we see from doctors a lot, to hear actual joy coming through them when they talk about their jobs or their careers. And so that leads me to my next question. What does get you going every day here at Workit Health?
Max, it's our members, and it's all the people out there who could benefit from joining this special membership. The great advances in neuroscience research that I mentioned a few moments ago have happened at a time when every important needle of measurement in what matters most to our members has been going in the wrong direction. And as a neuroscientist, that's a difficult reality to swallow, and yet it is our reality. And so what that means to me is, if we want to reduce the suffering out there, which remains pervasive when it comes to addictive illness, we've got to own up to that reality. The experience of getting care for addiction is not good. The costs of that care are too high. And the ecosystem within which people try to figure out how to access that care is confusing and, in my opinion, broken. So one approach to that is to throw your hands up and say, this is an intractable problem. We're never going to make a dent in it. The other approach, which is the one I think Workit takes and inspires me and many others who are part of the Workit family to take, is to say, you know what? It's time to stop nibbling around the edges. It's time to start thinking about transformational type changes rather than incrementalism. And I am someone who believes that folks with lived experience are the ones, not doctors and scientists like me, who are going to know most of the answers for how we get from where we are today to where we want and need to be.
And we are very much in agreement on those things. First of all, that it's the members that get us going every day. It's, hearing their stories of success and triumph and turning their life around, that not only reminds me of my own journey, but just, makes being here at Workit just a wonderful experience. And also that our system is broken, our current system, and that it is too expensive, just like you said, that it's hard to access, hard to manage. That being said, how does Workit differ from traditional, inpatient, outpatient that we're used to, traditional systems that we are more familiar with?
Yeah, it's a great question. And I think there are a few key differences. The first is the delivery of the care that we provide was designed by people with lived experience. And folks like me are merely servants in that delivery system. We are guests in the lives of the members that we work with. That's a very different conceptual foundation for healthcare organizations in our country. And it cannot be understated. It almost becomes something that you assimilate to when you work at Workit, because that member-centered design and design thinking are so deeply infused in all the branches of the organization. I've worked for some pretty neat healthcare organizations in my career, some of which are doing some really neat stuff in so-called patient-centeredness. And Workit takes that to a whole nother level. It walks its talk. And I really think that some of the solutions to that broken system can come out of the way that organizations like Workit are trying to tackle the healthcare problem. And I just want to add one piece of this, which is the people piece. So the fact that the system is broken is doubly frustrating for the people who work in that system. Because you and I both know, Max, people who work in this field are intelligent, hardworking, passionate, well-intentioned people. And many of them have a strong streak of advocacy within them. And yet you have these amazing people working in a system that's not achieving results. It ain't the people, it's the system. And we've got to figure that out. We've got to figure it out fast, because even before the COVID-19 pandemic, the rates of burnout and frustration and exhaustion and, quite frankly, joylessness in healthcare professions was already at pandemic levels. So then you threw COVID-19 on top of it, and it's become an even bigger problem. One of the things that has been a silver lining about the pandemic is the rapid embrace of virtual care, which is something that we should have embraced a long time ago as a society. So I say that because the other piece of the Workit experience is meeting the member where he or she is at, accessing our care from the comfort of your own home, at your own schedule, on your own terms, and coming up with a way to actually deliver care in a way that celebrates that approach is something that we do every day, and quite honestly enjoy the hard work of doing.
Yeah, something with traditional systems of treating addiction kind of gave you the feeling like it was happening to you, a little bit punitive. You didn't really have that empowerment piece. When you're going through, a program like Workit, you're in charge, you're in control, and like people in recovery need those moments of empowerment, of feeling like they, a lot of times they feel like they have lost control of certain aspects of their life. So to put their treatment, their recovery, back in their hands through our modality, I think is just huge. However, we have tons of people, skeptical or uncertain about telehealth. In some ways, I'm still getting used to telehealth and its prevalence. What do you say to those folks that just don't think real recovery can happen via telehealth?
Well, I guess there's a few things I might say to that person. One is I completely understand your perspective. And it's a nice thing that, in-person care is still available. We are primarily a virtual healthcare organization, but we also provide in-person services. But I think what I would also encourage the person to think about is maybe what some of the barriers are that he or she might be experiencing to accessing care today. And if you're talking about addiction care, it doesn't take long before folks are coming up with a long list of reasons why it's not easy to access care. So one of the things is, hey, is it easier? Do you find the hurdle to climb over to engage in care to be lower than if you had to go somewhere physically? Do you find the psychological experience of receiving care in your own home or in whatever environment you want to receive it in to be less fraught by that stigma and shame that you and I were talking about a few moments ago? Do you find it more convenient to sort of do on your own time, on your own schedule? We even have an automated drug testing technology that lets people complete drug tests without someone watching them pee in a cup in a healthcare facility restroom. So there's a lot of practical reasons why virtual care has improved access for a lot of people. And that's especially valuable for folks that are part of a disadvantaged or disenfranchised population, minorities or minoritized populations, people in rural America, where transportation and brick and mortar healthcare centers aren't around the corner. The ability for technology to democratize access is very, very real. Now, if the person was more interested in the clinical science and wanted to have a nerdy conversation with us tonight, there's also a rapidly growing body of scientific literature, Max, that has compared the safety and effectiveness of certain kinds of healthcare when delivered in person through traditional brick and mortar facilities or over a telemedicine platform. And for the purposes of our conversation, the care is no different from a quality and safety perspective. And so without going into the details of those research studies, I add this stuff all up. The care is just as safe, just as effective, easier, more convenient, and more person-centered, and hopefully soon more affordable. Sounds like a good combination of ingredients to me, but it still may not be right for everybody. And that's why we want to meet everybody where they're at and figure out what the first step is that we can help that person take to get going on their recovery journey.
Amazing. Thank you. And of course, I am someone who had several attempts at getting sober in those in-person rehabs and then ended up getting sober through an online program. And no one was more surprised than me. But in fact, that just, lined up with exactly what I needed. And you had mentioned nerdy conversations, so I hope those continue. We're going to get into some real yummy stuff here. You've mentioned it a few times, patient-centered care or person-centered care, member-centered care. We hear that a lot in around here at Workit and in the news sometimes, kind of a buzzword. What does patient-centered care mean?
It's just funny that we have to even ask this question in healthcare, because it reflects one of the broken parts of the system, in my opinion. Maybe I can try to answer it first by contrasting it. So I'm a physician, and I was trained during a time when care was supposed to be delivered around my preferences and at my direction, and based on my expertise And if you, Max, were my patient and you didn't do what I recommended that you do, I called you something like a non-compliant patient. I blamed you. I don't mean to be unfair, because again, I'm just trying to characterize this to make a point. But the whole idea here is that the care and the care delivery has traditionally been designed not around the needs and preferences of the person receiving that care. And yet that's what great industries do. That's what the food industry does. And you and I can go to a fun restaurant and talk to the wait staff there, and you better believe they are homed in on the experience that their customer is having. Everything that they're doing is designed around that experience. And for a combination of complex reasons, healthcare wasn't designed that way. And the good news is that we recognize that. And a lot of important, brilliant, and influential people have been trying to lead a movement that has had to have a name because it's different than the status quo in American healthcare. And so patient-centeredness really is a call to action for all of us who are in the healthcare field to really get serious about defining what does care look like, what should the experience of care be, how do we define quality of that care, and the person who gets to answer all those questions is not the physician, but it's the patient. And my job as the physician is to figure out how to partner with that patient in the design of that care. So to talk a little bit about how Workit does that, because traditional healthcare systems keep operating, in traditional ways, but they have patient advisory councils, or they have a group of people that meet once a quarter and they do focus groups with them. That's great. Everyone's got to start somewhere. At Workit, we actually bring patients and members right to the design table. And one of the most challenging and exhilarating parts of my job as chief medical officer is I get to work with a lot of people every day who are telling me, hey, pal, you seem like a nice guy, but we're not interested in doing it the way that you always have. And that's challenging for me, but it's incredibly stimulating and it's deeply rewarding. So member-centered, patient-centered, it's all about designing the care experience and the value of that care experience around the customer. That is our member.
And does that go hand in hand with patient-led design? Is that kind of all a part of the same thing?
Yeah, absolutely. So if you think about patient-centered care, how would you design, for example, an addiction care system that eliminated the stigma around drug testing? Okay, and a physician-centered design might say, well, okay, I hate stigma. I'm going to combat stigma with every ounce of energy in my body. But I'm here at my clinic and my patients need to come into this clinic and we're going to try to change the workflow around in the clinic. But it's still got to work for me. Where patient-led design or patient-centered design takes over is forget everything we already know and have been doing in traditional drug testing. And what is it that we're trying to achieve, not only from the scientific perspective, but primarily from the member experience? And you start to realize just how important, and I say realize because that's what physicians do when they do that, they realize something that our patients have known all along. But they realize that the way to most rapidly reduce the stigma and shame around the traditional experience of drug testing is to have patients tell you how to design the drug testing experience. And what's so cool about that is if you can empower patients with that opportunity, they will tell you the most amazing things from a design perspective. And you'll say to yourself, gosh, why didn't the field think about this 10, 20, 30 years ago? And, you know, quite frankly, shame on us for not being more patient-centered sooner in our society. So being patient-centered means involving patients and partnering with them. Patient-led design means literally putting them at the design table.
I love that, because I love to put our members at the design table from a community perspective too. And so we share that. And I really just am in such alignment with the way we do things here at Workit with that. I was recently reading an article that you were in, Dr. Coffey, and you stated that we need transformation in the way that we treat addiction as a society. I know you've touched on it a little bit since we've started talking, but what did you mean by that, by the transformation in the way we treat addiction in this society?
Well, the traditional medical scientific approach to improvement is the discovery and generation of new knowledge, you know, science and research. And these things are really important. They've helped us make amazing advances. The fact that despite the advances in neuroscience research over the last 20 years, when we still look at one of the most important measures of addictive illness, mortality, the deaths in our country from drug and alcohol related conditions, including, of course, overdoses, but also including all kinds of health related conditions like hepatitis and others, the mortality from those conditions is going in the wrong direction. So here on the one hand, we have more knowledge about how the brain works, more science about how we should try to treat these terrible illnesses, and yet more people are dying from these illnesses than ever before. And so I think that we want that research work to still continue. It's really important. But in the meantime, we have a huge gap between what we already know is safe and effective in terms of care for addictive illness and the very small number of people who are actually receiving that care today. So the new focus in population addiction health is how to figure out how to get the treatments that we know are safe and effective to all these people who are dying from these conditions. And so that work is a different kind of science. It might be called systems thinking or improvement science. And it's the study of how systems work, and in this case, how they don't work. And so one of the things that I meant by transformation is, rather than focusing only on the neuroscience of addiction, we've got to think in drastically different ways about how our society views addiction, how we understand and want addiction care to be delivered. And as we were just talking about, that means bringing people to the decision-making table who've not been there before. So it's time to stop nibbling around the edges, in my opinion.
I even just love the thought of bringing people to the table just as an image. I love that.
Yeah.
So a lot of people, myself included at one point, are kind of looking for that one perfect solution to addiction, whether that's just behavioral health, or it's just medication, or just 12-step meetings. Can you kind of address that viewpoint for us?
Yeah, I can certainly try. You know, one of the things that I think each of us especially in our society, has is a desire for the quick fix. And I have that as much as anybody else does. And quite frankly, I don't begrudge anybody for wanting to get to where they want to be the quickest way along the path of least resistance. And if someone with a substance use condition finds that kind of recovery experience, good on them. And I'm very happy for them. In many cases, though, the illnesses that we're talking about here are biological illnesses, psychological illnesses, and social illnesses. The addiction does indeed affect the brain in very specific ways, but that brain is part of a human being that's experiencing in psychological, intellectual, and emotional ways what it's like to be suffering from addiction, and that influences behaviors and interactions and perceptions of the world and interpretations of the world. And those two things combine into in a social environment that also can influence not only the experience of the illness, but the outcomes of that illness and the care and the quality of care that that person may or may not receive for that illness. So if we think about the illness in that biopsychosocial way, we will not be surprised to then go to the scientific literature and see that at a population level, when individuals with addiction receive care that is biopsychosocial care, the outcomes tend to be better than if they receive only one of those forms of care. So now, an important piece of that is the desire for the individual to be in control of his or her own recovery. And so if someone wants to focus on only one of those aspects of care and wants to start with just one, we'll meet them where they're at. And if they're not interested today in the social implications and challenges of their addictive illness, that's okay. Come on in, we'll get started. But in general, Max, when we look at the science, outcomes are better for biopsychosocial illness treatment when all forms of that treatment are combined and delivered in a way that's engaging and sort of reflective of a partnership between the individual and the care team.
Oh, absolutely. And just listening to you talk, I thought about maybe the tensions between, some 12-step meetings don't consider MAT, medical assisted treatment, to be sober. And so there's a tension there. Your therapist, if you're lucky to be within care, might not feel that they're a chemical dependency counselor, so they might put you to someone else. And so it is hard to find that one-stop shop of the biopsychosocial. And one thing I love about Workit in particular is that we do have all of these aspects all in one place. Because I think sometimes people might feel alienated from one of the aspects that we discussed. So yeah, that's fantastic.
Yeah,
thank you.
You're right on, Max. And the one-stop shop mentality is hard to deliver within this fragmented system that we're talking about here. And one of the things to keep in mind is that care doesn't have to look like the way we've always thought about it or seen it in the movies or on TV. So for some individuals, maybe the biological part of that care is coming from, a traditional healthcare provider. Maybe the psycho part of the care is coming from a religious figure or a church leader who that person is deeply connected with in a coaching, counseling, supportive kind of mentor way. And maybe Workit community, like what you are doing so especially for us, is a way that folks can find social connection, and that can enable so much along the road to recovery. So I don't mean to imply that although outcomes are better when biopsychosocial care is delivered, that necessarily each of those aspects of care has to be delivered from within the same roof. Sure, it can be convenient when that happens, but it's not always the case, and it may not be what each individual prefers.
Yeah, and like you said, you can kind of dabble, stick your toe in one if you're not ready. For example, when I got sober, I didn't want community for about a year. I wasn't ready to. I needed to be with myself, getting sober, doing my rituals, my routines, kind of like just getting things ready. And then I started to want to go out into the world. So it just comes back to everyone's journey, so unique, so different. And I love the way that we honor that here. Yes.
Me too. Me too.
Yeah. One of the other things we honor as a segue is harm reduction. What are your thoughts, viewpoints on harm reduction?
Harm reduction is, to me, another one of these funny concepts, because it's a reflection of a shift in thinking within the field that probably shouldn't have required a shift in the first place. But the general idea, Max, is we know that these health conditions, substance use disorders, every single one of them has a mortality associated with it. And some of these conditions, like opioid use disorder in particular, have incredibly high mortality rates. That means the risk of dying from the illness. And so harm reduction means let's get very clear at the very earliest stages of the illness that goal number one is not dying. Okay, let's just make sure we're doing everything we can to make sure that we're lowering that risk of dying. And that's not always been the first or primary or most immediate goal of care in the field of addiction. And so harm reduction then tackles something called morbidity next. So mortality is dying, and morbidity is having pain, suffering, and injury from the illness. So goal number one, we're going to keep you alive. Goal number two, we're going to try to put in place all kinds of barriers that will lower the risk of some type of harm befalling you. And then we get to that phase of recovery where we start talking about thriving. So harm reduction gets really, really concrete about the serious risks of these serious illnesses that we try to treat, and packs no punches in terms of what we can do to reduce that risk.
Yes. All right. And that's one of those words that kind of gets thrown around a lot, or as a buzzword. And I really appreciate you kind of taking us through that step by step to really understand its impact and its meaning and how important it is. So my next question, I'm just taking a look at our time, and you've been great, Dr. Coffey. I've had you on the hot seat for a while now. What do we have to look forward to in the future with any changes, improvements, exciting news with Workit Health? What can we look forward to?
Well, in the spirit of member-led design, I should be asking you, Max, what do you think we need to have on the horizon? One of the things that I'm really excited that Workit's about to launch is an ambassador program, which is super, super cool. But in terms of the member experience, what we try to do every day is two things: learn and improve. And when we're trying to tackle nasty, complex illnesses like opioid use disorder or alcohol use disorder or stimulant use disorder, we know that we've got to try to bring our A game. And that means providing all the kind of care and services and support that members with those conditions tell us they need to really get well and thriving. So, for example, we believe at Workit that high quality care for opioid use disorder also means care for problems with methamphetamine use. And so we have a program for stimulant use disorder that can be combined with our program with opioid use disorder. We know that alcohol use disorders really are quite comorbid with other addictive illnesses. And so we have treatment services for those types of conditions as well. And then let's not forget about all the psychiatric conditions that can come along with addictive illness. So depression, anxiety are two of the most common. You know, the rule rather than the exception in substance use disorder care is that there are other psychiatric or behavioral health conditions there as well. And so we wouldn't be treating the whole person if we couldn't provide care for anxiety. We couldn't also provide care for depression. And we've been talking a lot about the brain tonight, but like I said, the brain and the body are always talking with one another. So we know that a lot of people suffering from addiction need help with infectious disease conditions, with conditions like hepatitis. Lots of women with substance use disorders come to us for help with reproductive care. So there's a lot that we've been building out to try to provide whole person care. And our hope is that as we build that those additional programs out, that people will have an even richer and more rewarding experience in our programs, and that will help them talk to their families and friends and neighbors about that experience, and that will help us grow this movement. At a very practical level, Max, you know, we're in about 18 states today, and we want to be everywhere tomorrow. And so that's a lot of the work as well from a operational and strategic perspective.
Yeah, I personally cannot wait till y'all hit New York, my home state. I'm looking forward to that. We need you and we need Workit Health. So that's very exciting too, all of our across the country, all 50 states.
You know, my wife's a New Yorker too, so she's waving the New York flag too, Max. And you know, I have multiple family members on my wife's side that are in law enforcement. And in fact, my father-in-law is a retired undercover narcotics detective. And you want to talk about folks I've learned a lot about addiction from. His experience living and working undercover has been incredibly illuminating and has taught me all kinds of stuff I never learned in medical school about how addiction works in our society. So yeah, let's see if we can get to New York very soon.
Oh, absolutely. And this one comes in from our members. The question is, can you tell us if there are plans for Workit Health to be more accessible to people who are sick and suffering? And I'm not exactly sure what that means, but maybe folks that are a little bit more against the online aspect, or maybe not comfortable with the online aspect, or just don't know about this option in general. Accessibility, how do we get to be a part of more folks' lives?
Well, I love that question because really access is kind of one of the drums that we beat at Workit. So we're constantly working on this through how do we refine and enhance our technology to make it easier, more reliable, more enjoyable, friendlier to use? How do we make the care that we provide more and more affordable? That's really, really hard work. And how do we bring care to more difficult to reach areas like rural America or underserved populations? You know, it's heartbreaking when you look at all of the terrible outcomes that come from these conditions, and how these terrible outcomes disproportionately affect minority, minoritized, disenfranchised populations. We have serious social justice and health equity issues to try to overcome in this clinical space. So there's plenty of work to do, and all of the teams that we have at Workit Health that are trying to tackle these challenges are all doing so inspired by the goal of making it easier to access our care.
I love that. And I've got one more question for you tonight, Dr. Coffey. And it's, what are some of your other passions within the medical field? So when you're not geeking out on the brain, what else do you like to get into? Medical or non, heck.
Yeah. Well, you know, I like being a part of the healthcare field. One of the reasons why is because there are different types of work that one can do in the medical field. Obviously, the most rewarding is to provide great care to patients and members. There are other types of work, though, too. There is technology design, there's teaching, there's writing, there's research, there's systems thinking, there's policy and advocacy. So I love the opportunity to get to do bits and pieces of all that stuff in a way that, in my mind, is all woven together by a thread of service to the members and trying to reduce the suffering from these terrible illnesses. So sometimes, you know, you'll find me, you know, reading some nerdy medical journal about the brain science of opioid use disorder, and sometimes you'll, you know, see me reading the New Yorker magazine, you know, and sometimes you'll see me talking to my father-in-law about, you know, what does he think we should do with, you know, the methamphetamine problem that you know, we're talking about over the dinner table. So those are kinds of things that really wake me up each day. I don't feel like I work most days. And it's really a testament to the special organization that is Workit Health, and really truly the people that are part of the Workit family.
And Dr. Coffey, I couldn't agree more with you. And I love the way you fully immerse yourself into things. Another thing we have in common. So y'all, on behalf of us at Workit Health, I want to thank you for coming out tonight to this Q&A or watching us on live stream, and to the folks who may be watching this later on recording. I just want to thank y'all and thank you, Dr. Coffey, for your time and for your wisdom. Specifically for taking the time to be open to talk to us and answering all the questions that came in throughout the week. A lot of us don't get to have these conversations with our doctors, with our providers. We don't get to hear what they think, feel about these topics, especially with addictions. We don't always come in trusting our doctors. And so, you know, talking with us tonight is, I feel, going to go a long way, especially with virtual care. You know, we like to know who we're dealing with, who the doctors are. What did we get into? And so this was just an incredible experience, and I hope it was for all y'all. So thank you so much, Dr. Coffey.
Privilege, it's a privilege. Thank you, Max.
Absolutely. All right, y'all, take good care of yourselves and each other. Keep working it. We work it together. All right. Good night, y'all.